I got asked the other day by a patient why physiotherapists have a fascination with ice. You see that physiotherapists tend to use ice quite a lot, and it is a really good tool for acute injuries. And what does acute mean? Acute means someone who's just injured themselves. So if you see people on the sporting fields, the soccer sporting field, football, all those bits and pieces, you'll see as soon as someone gets an injury, you'll often see that injury wrapped in ice in some way. It comes back to the what our Sportsmen Association talked about is the RICER. In RICER being an acronym for rest, ice, compression, elevation, and then at the end referral onto appropriate vehicles. Now this can be used at any time, and it doesn't have to be used if you're just an elite sports person or just an amateur sport person. Even if you're someone in the garden and you roll your ankle, you follow the same process. That process is when you roll the ankle, the R part of it, which is rest, and that's relative rest, which means that you go, okay, well, you're not going to continue finishing the whole garden off in that day, so you need to back off because you'll increase the swelling. Rest, ice. Now, the reason that we apply ice to the area is that cold is a vasoconstrictor. It means it constricts the blood vessels. This constriction of the blood vessels means that there's not as much fluid coming out of those vessels to create too much swelling around the area. The other beauty of the ice is that when you apply compression. That's the C part of it. And what does compression do? Compression again stops how much swelling is occurring around the ankle. The compression on the outside competes with the compression on the inside and equalizes it. Then there's elevation, and what we talk about elevation is getting that body part or the injured part above the heart. So sitting upright and having your foot on a chair means the foot may be elevated to you, but it's not elevated in relation to the actual heart. Why we elevate the part is to allow for the blood flow and fluid that builds up from an injury to flow back into the body where it needs to be. It doesn't pool around the actual injury. Why is pooling of the fluid or the inflammatory exudate, if you want to call it, or the healing fluids around the injury a bad thing? Well, it's not a bad thing. The body needs these fluids to actually create the healing process. What happens is the body's a little bit like an overprotective mother or parent in a way. What happens is it sends too much fluid to the area. That fluid then builds up and becomes a jelly-like substance, and then we get a whole bunch of scarring and stiffness of the ankle. So if we can get rid of most of that fluid and have enough there to heal with the healing process, then we're going to get a better healing process. We're going to get and we're not going to get quite a stiff and tight area. And on top of that, we're not going to have quite as much scar tissue. It's the scar tissue that really tightens up the areas. So a great example is an ankle injury or a cork thigh. A cork thigh is basically an impact injury to the muscle where it's made a bleed, and the bleed is into the muscle tissue. Now that bleed will create scarring. If we have a large amount of scarring, we're going to get tightness of the muscle. That tightness of the muscle then means that we're a bit more predisposed to getting injury in the area. So with the ankle, if we have too much scarring around the outside, the ankle becomes stiff. But we need a mobile ankle to be able to perform all our sports. And ankle injuries are one of the most untreated areas of injuries. People just assume, oh, it's just an ankle injury. And the amount of people I come in who've had one ankle injury, and then because of that one hadn't been sorted out in the first place, they get the second, third, fourth, fifth, and sometimes going on to have surgical repair of the tendon ligaments around the actual ankle. I personally like to get hold of the person after their first ankle roll as soon as I can, give them all the appropriate information, and then advise them on what things that they need to do to improve that ankle. One of my talks that I'll be coming up in the future is about ankle injuries, and I'll delve a little more heavily into that. I'm also going to be talking soon about knee injuries, shoulder injuries, lower back injuries, and giving you some insight into the anatomy of the area, the problems that occur in those areas, and hopefully give you some ideas on how to manage some of the conditions that you have in those areas.